is Stephan de Beer, who is participating from South Africa, and he's based in Pretoria as the director of the Center for Faith and Community.
Good afternoon, and thank you for this space. My colleague in our Faculty of Health Sciences at the University, Yanni Higu, says, as a medical doctor, if I have to write a prescription for homelessness, it will be housing. Not only does housing address the issue of shelter, but also of primary health care, economic access, and psychosocial well-being. In my context, we often struggle to make the link between ending homelessness and affordable housing. We often pathologize those who are homeless instead of understanding homelessness as systemic failure to deal well with vulnerability. Since 2015 in our city, we built a social compact between local government, 2 universities, and a broad-based civil society group, the Tshwane Homelessness Forum, gathering 30 non-profits as well as people with lived experience. We engage in ongoing evidence-based research, drafted a policy on homelessness, adopted by local government, and now implementing it. Whereas the policy was adopted in 2019, it was really the impact of COVID and the hard lockdown of 2020 that activated implementation. A homeless task team was formed, which operated like a central command center, coordinating a risk reduction strategy. In a 10-day period, we were able to open 27 temporary COVID shelters, housing 2,000 people, complemented by psychosocial and healthcare services, family reconciliation, and vocational preparation. We managed to do in 10 days what we could not do in 10 years before that. We can never again say it's impossible to house the homeless population because COVID proved we can if we wanted to. The city then asked the university to formalize the task team, and we created an operational center now providing technical capacity and research support to the city and the non-profit sector for implementing the policy. We developed a capacity building series. We run quarterly community of practice where non-profit workers, government officials, and researchers reflect together on what we're learning. For the first time, the province we are in, Gauteng, also has a policy on homelessness and invest in homeless programs only since 2021. We had an opportunity to draft a recommendation for a national policy platform to the presidency, and in November of 21, a process started towards a national homeless policy that should help secure budgets for cities and provinces, formulate guiding principles for strategies to end homelessness, and make the necessary linkages to related housing, health, and other policies. In 2017, a national homeless network was established as a movement connecting people from 8 South African cities to advocate at different levels of government, to share information on good practice, and to develop a common research agenda. Tshwane also became a vanguard city of IGH in the same year. In our city, the face of homelessness is constantly changing, growing number of older people, students. Today, almost 50% of the homeless population being young, healthy, but unemployed, as symptomatic of South Africa's unemployment rate. A growing number of so-called working homeless people opting to live in the proximity of workplaces as a response to long traveling hours, spatial inequalities, and poor public transport. And so unless we create affordable housing close to economic hubs, we will not end homelessness for many people. In addition, thousands in all our cities living in precarious housing, often being vulnerable as they might face eviction any time. In our city, homelessness is currently addressed by a combination of more than 2,000 shelter spaces. That's about 300% more than before COVID. So COVID, in that sense, had a great contribution to make. Affordable social housing and free housing first pilot projects focusing on mental health and older persons with great success. We are now convinced that we can end homelessness for older persons, persons with chronic psychosocial illnesses, and students. We need to combine crisis housing to prevent people from falling into chronic homelessness with affordable permanent housing. We believe we've created sufficient prototypes, tested and working, and now have to find ways of scaling them so larger numbers of people can exit homelessness. One movement in our city not only managed 4 transitional housing facilities, 3 housing first projects, and 1 palliative care facility, but also developed 1,500 social housing units now accommodating more than 5,000 people per night. If this can be replicated all across the city, homelessness can end for large percentages of people. ongoing evidence-based research, the capacitation of civil society and the faith-based sector, political will, and appropriate investment matching the homeless challenge are what is now required. And currently, we're developing a localized methodology for counting to be piloted in September in order to make sure that our interventions are aligned to accurate, reliable data. And so we need to embrace, we believe, the following at all levels of government: right to housing as a critical element in ending homelessness, combining diversified housing continuums with housing-first approaches, responsive, collaborative, innovative institutional infrastructure crossing disciplines and departments, adequate access to property and land for housing homeless communities, sustainable and sufficient resource base for investing in built-to-scale solutions, and measurable data-driven commitments to end homelessness. In wrapping up, I'm reminded, and we were greeted by our former president in the foyer, today, 27 April, is Freedom Day in South Africa, celebrating 28 years of democracy. But, said President Mandela, as long as many of our people still live in utter poverty, as long as children still live under plastic covers, no South African should rest in the joy of freedom. Perhaps to add, as long as profit is prioritized over people when we think of land and housing, and as long as overcoming homelessness is seen as a charity or social development concern only and not as an expression of social justice, the global homeless population will not be free. We know now probably how to end homelessness. We do not yet know if there is sufficient moral and political will to do so. We will be measured by our collective failure or resolve. Thank you.
Stephan, thank you very much.